what I'm going to show you is what you're going to need if you are asked to set up for a Swan-Ganz catheter insertion or pulmonary artery catheter insertion. First of all, you'll need consent from the patient if the patient's able to give consent. You also need a documentation of a timeout prior to starting the procedure, and this is to ensure that you are doing the right procedure on the right patient. And Saddleback Memorial has a stamp that is used for documentation. It's called the timeout stamp, and that can be placed on your nursing notes. You will need set up for the physician a sterile gown, sterile towels, appropriate size sterile gloves, skin prep, and we no longer use betadine for skin prep. This is the ChloraPrep, which is the chlorhexidine solution, and these are the little applicators. A box of sterile 4x4s, heparin flush bag, this is the 2 units per ml, a pressure bag, an introducer kit or a cordis kit. We use the 7.5, which is what our Pyxis is generally stocked with. There are other sizes available, but this is usually sufficient. The Transpac bifurcated monitoring kit, and that is used to set up the pressure lines for the Swan-Ganz. A cardiac output or room temperature injectate delivery system, and the Swan-Ganz or pulmonary artery catheter itself. Generally our physicians are using the 7.5 French VIP catheter. What you need to do is prime all of your tubing. You'll of course need the modules for the monitor and the cable boxes. For demonstration purposes, I am not going to open these boxes, but your job to set up for this will be to prime these lines, which are inside the box of the bifurcated Transpac monitoring system. And you will need to prime these lines with the heparinized saline. You will spike the saline bag. You don't need to put it in its pressure bag at this point. Spike the saline bag, and it's helpful if you are able to hang this for gravity flow. And you're going to prime all of this tubing. And inside this kit, there are caps, and you will need to change out these caps once you are primed. And that is because these caps are open-ended, and that's so you can prime this line without removing the caps to keep it as sterile as possible. And you do that by squeezing this device right here, which allows flow to come through the tubing. Once you've turned the stopcock off to the end of here, you prime out this port, and then you take this cap off and replace it with yellow, and finish the priming down to the end of this catheter. You will only need to remove this white cap and replace it with the yellow right here, and this end is open-ended, and you can leave this on. This will be what you will hand to the physician during the sterile procedure. And then you do the same for the yellow tubing here, which hooks to the PA distal port. Once all your tubing is primed, you can then place the heparinized bag inside the pressure cuff, and once it's placed in there, you can inflate the cuff until the green line is seen on the pressure indicator, and that indicates that you have 300 millimeters of mercury pressure, and that will deliver 3 cc's per hour of the heparinized saline to keep the end of the catheter open. The physician will choose the site on the patient, and you just need to make sure that he has a tray available in his reach or her reach to be able to work in a close proximity to the tray and the patient. And your job will be to hand he or she the ends of these catheters, and by using sterile technique, you will be asked to open this and connect to the Swan-Ganz catheter once he has the percutaneous introducer into the patient. You will need, prior to that, to have connected the transducers to the pressure cables on the monitor and zero those to the appropriate level on the patient to ensure that when the physician is putting the catheter in, he can obtain accurate insertion waveforms and pressure readings. Once the procedure is complete, you will be asked to dress the site. We usually use a tegaderm or an op site over that, and if it is placed anywhere in the chest area, you will need to obtain a chest x-ray to ensure proper placement, as well as that the patient did not develop a pneumothorax. If it is in the ephemeral approach, you don't need a chest x-ray to confirm that the patient doesn't have a pneumo, but you do need to confirm placement of the PA catheter. It is not mandatory at that point to have that, because your waveform should indicate where you are on the catheter.